name is Hanna Shahine. I'm a urology specialist at Emirates Hospital Group. What we do as urologists is treat what we call urologic diseases. Or first starting with stone disease. Stone disease is a common disease. We see it a lot in our clinic. Most patients ask about what should I do to prevent stones, or if I have stones, what should I do, my diet, how much water should I drink, questions like that. So basically the message is with stone diseases, any patient that would like to prevent having stone disease or who has stone diseases, the message is drink water as much as you can, but basically it's a minimum of 1 liter for every 25 kilograms of body weight. Second of all, the diet, you shouldn't change much. You can eat everything in moderation except 2 things, red meat and salt. Don't add salt to food, and eat red meat in moderation. The second disease we encounter a lot is prostate diseases. Prostate diseases being prostate cancer or what we call benign prostate hyperplasia, or the benign disease of the prostate, which usually causes urinary symptoms, and patients, mainly males, come to us with urine symptoms. The message here is that don't delay visiting your urologist. So whenever you feel any urine symptom, please visit your urologist. It might be serious, it might be very benign, it might be very malignant. So please visit your urologist. Also discuss with your urologist, while you talk about urine symptoms, discuss erectile issues with your doctor. So any sexual dysfunction you're having, the urologist will ask you about it, but also you have to take the initiative and ask your urologist if you have any questions about that, or if you're suffering of any problem regarding erectile function. The third topic I would like to talk about are urine infections and mainly sexually transmitted diseases. The message here is, as much as possible, try to use protection when you're having a new partner or a partner that you don't know really. So every time you're having any kind of intercourse, please use protection. And if you doubt you have any sexually transmitted disease, or you have any symptoms of sexually transmitted disease, being urine symptoms, being penile secretions, or burning sensation in females also can be a sign of sexually transmitted disease, please visit your urologist. The assessment is super easy and the treatment is also easier. The last topic, which is mainly a message and specifically to ladies, there are 5 things that are not normal and you should visit your urologist for them without any delay. First of all, recurrent urine infections. Those are not normal. You should not live with recurrent urine infection. Number 2 is organ prolapse, be it uterine, bladder, whatever. Any organ prolapse through the vagina is not a normal finding and should not live with it, especially if you're disturbed by it. Number 3 is urinary incontinence. Also, urinary incontinence can be a sign of many different pathologies, including infections and many others. So always let your urologist assess you whenever you have any urinary incontinence. Fourth is overactive bladder, which causes urine frequency and urgency even without having a urine infection. This also can be, though the symptoms of urinary urgency and frequency without infection can be a sign of what we call an overactive bladder, and the treatment and the assessment is easy to do, so do not hesitate to ask about it. The final message is to women with pelvic pain. Pelvic pain is not normal. Don't live with pelvic pain. Either visit your urologist or you can also be assessed by your gynecologist, but do not live with any pelvic pain and consider it as normal. The final message on the final note, is the message to men or my male patients or male patients in general. 2 things. Before the age of 40, you have to check your testicles on a regular basis under the shower, wherever you're having a lukewarm water showering with lukewarm water. Please palpate your testicles. If you feel any hard nodule coming out, get checked with your urologist. And for males above 50, get your prostate checked yearly, which is 2 simple exams. One is the clinical exam we do in the clinic, and the second is a simple blood test. Don't delay those investigations, because any early diagnosis of those 2, either testicular disease or testicular tumors and prostate disease or prostate cancer, early diagnosis can have a very high cure rate. Thank you.